Hi guys, Rachel Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, we're gonna start with everything you need to know about earwax. Coming up. While many of our videos on this channel are geared towards hearing aid users themselves, I'm often asked for resources for caregivers and support members that they can use to better serve and help someone that they know that wears hearing aids. For that reason, today begins a 4-part series covering everything that you need to know about hearing treatment overall, beginning with earwax. But before we dive in, you know the drill. Please give this video a thumbs up to bring more videos like these to a wider audience. And if you've got a second, go ahead and hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, why start with earwax? Well, earwax poses major issues for both hearing and hearing aid use. Earwax, also known as cerumen, is a waxy substance created in the outer third portion of your ear canal. And while many people find it gross, it actually serves many purposes. Earwax forms a waterproof lining for the outer ear canal and can even help to prevent bacterial and fungal infections. It also helps to keep the ear canal moisturized, and it latches on to any dirt, dust, or hair with the goal of carrying it back out of the ear. Because the ear canal lining sheds in an outward spiral, it should, in theory, over time, naturally work its way back out of the ear canal. However, ear canal size and shape, as well as earwax consistency, can result in major earwax buildup. Over time, it can end up blocking the ear canal entirely. This can cause a major decrease in hearing that even shouting doesn't seem to overcome. Earwax buildup can also trap moisture and debris in the ear canal, which can cause itching or even painful infections. And even worse, earwax can work its way into hearing aid parts, reducing or even blocking sound entirely, and in many cases, working its way into the hearing aid parts and requiring repairs. Now, your clients, patients, or family members' hearing care professional should be routinely identifying when earwax is becoming an issue. They should be either removing this earwax professionally or referring you on to another medical provider that can get this earwax removed, as this is really a huge part of best practice audiologic care. But as a caregiver or a support member, how can you determine when earwax is really becoming a problem? The first way to know that earwax may be building up is noticing a significant change in hearing that doesn't seem to be solved by cleaning the hearing aids. Now, this will be reviewed much more in depth in video 3, but for now you can check out this video that I did on cleaning Phonak hearing aids, just to review some of the basics of cleaning and maintenance and some of the important hearing aid parts. This process includes changing the wax traps or the wax guards on the hearing aids, which is the most likely culprit when your hearing aids seem to just stop working out of the blue. If the hearing aids are clean and clear, but the hearing still seems to be pretty reduced, this could be a sign of earwax buildup. Another sign of potential earwax buildup is when you see visible earwax on the hearing aid parts themselves. Because all hearing aids have some sort of component that actually goes into the ears, these parts of the hearing aids can start showing the potential for earwax buildup before it really becomes a problem. If the hearing aids have a lot of earwax buildup on the domes or on the custom ear molds, this could be a reflection of the level of earwax buildup within the ear canals. The final sign that earwax could be building up in the ears is a new problem with feedback, the whistling, squealing, or squeaking sound that you might hear out of the hearing aids. Now, feedback can be due to many causes, but new or suddenly developing feedback can often point to a buildup of earwax. This is because that wall of earwax essentially serves like a backboard, kicking the sound from the hearing aid right back out of the ear again. This sound is then picked up by the hearing aid microphone and reproduced, causing this squeaking, squealing, or whistling type of sound. But now that you know when earwax may be a problem, you're probably wondering how the heck to remove it. First, and I know it's tempting, you will want to avoid using any sort of cotton swab or removal tool. Without the expertise and being able to visualize inside of the ear canal, you can actually do a lot more harm than good here. Oftentimes these tools just end up packing the earwax even deeper and can even cause injuries to the ear canal or to the eardrum. Second, do not use any sort of earwax softening drops if you do not plan on flushing the ears out afterwards. Earwax softening drops are supposed to do exactly that, break down hard earwax. But it doesn't do any good to simply break the earwax down if you don't plan on helping it out of the ear canal. My recommendation is to use 10 to 15 drops of Earwax MD while they're laying over on their side for about 10 to 15 minutes and then switching sides. After that, follow it up with a bulb syringe using some body temperature water to really flush out the broken down earwax. Be sure to ask their hearing care provider what they recommend as far as how often to be completing this, but as a general kind of rule in our office, we do recommend that patients complete this proactively around once a month to keep the ear canals clean and clear. And if you want to learn a lot more about this product and how it's best used, you can definitely check out our videos that will also be linked down in the description below. But better than at-home removal, your best option is to really schedule regular visits with an audiologist or ENT physician for professional earwax removal. They can use methods like tools, irrigation, and even to remove earwax safely and effectively. It's time to schedule a return visit to their hearing care provider for the following issues: hearing aid function that is not resolved with cleaning of the hearing aids, a change in hearing that is not resolved with cleaning of the hearing aids, new or unusual feedback coming from the hearing aid, and unsuccessful at-home earwax removal or hearing that remains unchanged after removal attempts. Earwax can cause issues for both hearing and hearing aids, but not if you have a plan to remain proactive and prevent earwax buildup before it becomes an issue. That's it for this video, but stay tuned for part 2 of this Everything You Need to Know series, Caregiver Edition, which will cover all of the basics about hearing aids.